Between 2012 and 2014, British Columbia saw a 7-fold increase in fentanyl-related deaths. This equates to around 25% of all deaths related to illicit drug use. In 2015, there were 16 reported fentanyl overdoses in one day alone. Evidence indicates that a substantial proportion of illicit drug users have witnessed an overdose death, which could have been prevented through prior training along with the administration of home-based Narcan. As Narcan training and public distribution are becoming more widespread, it is important to evaluate the impact these programs are having on overdose rates among opioid users. This concept of home-based Narcan programs brings forth the proposed question of whether access to self-administered Narcan kits reduces the incidence of potential out-of-hospital death as a result of opioid overdose in high-risk populations. 5 peer-reviewed articles were studied, and it was unanimous that, in fact, home-based Narcan does reduce out-of-hospital overdose deaths as a result of opioid overdose. The literature review did, however, identify 3 variables that could improve the delivery of home-based Narcan. These include evaluation of distribution locations, ongoing education to ensure competency, and comprehensiveness or coverage. The drug users that inhabit Vancouver's downtown east side align with many of the populations outlined in the literature reviewed. This population in particular consists of over 4,600 intravenous drug users in the downtown east side alone. This demographic often exhibits lack of consistency in accessing services. Sporadic use of these sites equates to reduced interaction with healthcare services, further marginalizing this demographic. Due to many drug users' unstable circumstances, these individuals are often highly vulnerable to adverse health outcomes. This population is stigmatized and mistreated not only within their community but among healthcare providers. In addition to access and avoidance of healthcare services, it's important that at any one time, about 50% of all drug users are living in unstable housing conditions, whereas 10% live on the street with no fixed address. The proposed intervention surrounds incorporating a peer-run mobile-based education and Narcan kit delivery system to reduce gaps in dispensing as well as population coverage. A peer-based approach plays a significant role in harm reduction because of their ability to reach those at greatest risk. Many strengths of offering a peer mobile-based education and Narcan kit delivery are related to accessing oftentimes inaccessible population, an identified barrier from the literature. Potential weaknesses of this strategy include reliability issues related to peer educators and dispensers due to their constant interaction with drug